Hi students, welcome to the next video in your epithelial tumors. This video we will discuss about melanoma. Melanoma is a very important topic. You can expect a question from melanoma in your NEET INCT examination. Okay, so we are talking about melanoma. Our concern is oral mucosal melanoma. Actually, melanoma can come in skin and your oral mucosa. Okay, skin as well as your oral mucosa, and both are different actually. Okay, and they are tumors arising from your melanocytes. Okay, melanoma arises from your melanocytes. Okay, the tumor of your melanocytes, and it is very aggressive, very aggressive. I say, I think there is no what escape from this melanoma. Once you are hit by melanoma, your life expectancy is very less, and I think death of 90% of the cases within the 5 years. Okay, life expectancy is very less. We say overall survival. Okay, overall survival in cancer, we say overall survival. Overall survival is very less in melanomas. Okay, that aggressive it is. And it's a tumor of your melanocyte. And oral mucosal melanoma, if I write oral mucosal melanoma, what is the most common site of oral mucosal melanoma? That is what you are seeing in this picture. That is your hard palate. Hard palate is the very favorite site for this oral mucosal melanomas, and you can see in this picture that is that black pigmented lesion there. It is very much swollen. Okay, that is a lesion there. This is how melanoma is usually present, and sometimes it can come without any pigments also. Okay, it is not necessary that it should always have the pigments. Okay, it can come without pigment also. Then we call it as amelanotic melanomas. Okay, when there is no pigment seen, we call it as if there is no pigments present, we call it as amelanotic melanoma. Okay, so this can also happen. And melanoma, what's the reason, etiology reason for melanoma? One is mainly due to this UV exposures cause the most amount of melanomas. UV exposure, sunlight. Okay, and melanoma can result from a pre-existing mole, which was the type of mole or nevi which was having a high tendency of transforming to melanoma. I hope you remember when we were talking about nevi in our video of nevi, we discussed that. Please give your brain an exercise, revise, revision is the key. Okay, so that is your junctional nevus, junctional nevus. And if there is any change in the junctional nevus, it can transform to a melanoma. What other? You can have xeroderma pigmentosum, this condition. Okay, they can transform to melanoma. Pua therapy. Pua therapy is a therapy used for psoriasis, right? Psoriasis. For the psoriasis treatment, you give PUA therapy, Solaran and ultraviolet A. That is PUA, Solaran and ultraviolet A. That is a chemical which we apply on the areas of psoriasis, and we give ultraviolet A rays to therapy. But the after effect or the disadvantage of this therapy is if you are giving it more or injudiciously using it, they can lead to melanoma. So this is about the reason. And what is a gene which is commonly mutated in melanoma is CDKN. Okay, CDKN2A. CDKN2A gene is the most commonly mutated gene in your melanoma. Now, what they ask in melanoma is that melanoma has certain features. Okay, melanoma has two types of growth pattern. I will write like this. They have two type of growth pattern. The growth pattern is that, so you have a epithelium like this, you have the epithelium here like this, and you have the connective tissue. You know where the melanocytes are? Melanocytes are usually located in the basal layers, right? Here you have this melanocytes will be located here. So whenever there is a melanoma, the melanocytes can grow in two different patterns. Okay, either it can go in a radial pattern like this, radial pattern, or we say horizontal pattern. Horizontal, radial. It is going in a radial pattern, so in a horizontal pattern, or we say pagetoid pattern. Okay, it is going in a through the epithelium. It is going horizontal, radial, or pagetoid, or it can grow down. Okay, or it can grow down directly into the connective tissue. That is vertical growth pattern. Vertical growth pattern or nodular growth pattern. Okay, these are the two pattern of growth in a melanoma. So melanoma can grow either horizontally or vertically. Now, based on this, we have four different types of melanoma. So what are the four different types of melanoma? What is the first one? It is superficial spreading. Superficial spreading melanoma. Then second one is the nodular melanoma. Nodular melanoma. Third one is the lentigo maligna. Lentigo maligna, malignant melanoma. Fourth one is the acral lentiginous. Okay, acral lentiginous melanoma. So there are four types of melanoma. In newer Schaefer, you can see one more melanoma that is mucosal lentiginous melanoma. Okay, that is one more. Fifth one. This is seen in given in the new Schaefer. If you see the new Schaefers, there is oral lentiginous melanoma. Okay, that is new one that Schaefer has given. Okay, now what is the peculiarity is that what is the most common type of melanoma you see? That is the superficial spreading. Most common type seen is the superficial spreading melanoma. Nodular melanoma is called. What is the peculiarity of nodular melanoma is that it only show vertical growth pattern. Vertical growth pattern only. Okay, lentigo maligna melanoma, it will show, rest all the others will show both vertical and horizontal. Okay, all the other lesions will show both vertical and horizontal, but nodular melanoma show only vertical growth pattern. Lentigo maligna melanoma, the other name is called Hutchinson's freckle. Hutchinson freckle. And lentiginous melanomas. Okay, lentiginous melanoma, they are the melanomas found in the oral cavity. Okay, so previously it was only acral lentiginous, now oral lentiginous. Anyway, lentiginous melanomas are the one which is seen in the oral cavity. Okay, rest all the others are seen in the skin. They are seen in the skin. Okay, so oral mucosal melanoma is actually your lentiginous melanoma. Okay, lentiginous melanomas are your oral mucosal melanomas. Okay, and these melanomas, we can use certain markers to identify melanoma. So in few of your NEET question papers, they have asked about markers to identify melanoma. So markers, what are the different markers? IHC, immunohistochemistry. IHC is a technique. IHC is a technique, and by this IHC, we can find the lineage of the cell. Okay, so as this melanoma is very very deceive or very what a tricky lesion, we have to use, sometimes we have to use some markers. So please remember these markers. It is HMB45. Okay, HMB45 is human melanoma black. Human melanoma black 45 is a marker for your melanoma. You can use S100, you can use SOX10. Okay, MART1. Anyway, this was asked in one of the question, that why I am saying is HMB45. The name itself has human melanoma black. Okay, so that is one thing. Now, if you go to grade these melanomas, if you are going to grade these melanomas, you may have heard about ABCDE rule. ABCDE rule of melanoma, I think it is very familiar to you. There is no need to explain it again. A for asymmetry. Okay, how to identify, clinically identify is a melanoma or not? There will be asymmetric lesion. B for border irregularity, border will be irregular. C for color variation. Okay, color variation. D for diameter, diameter greater than 6 mm. So in acquired melanotic nevi, the diameter was less than 6 mm. Okay, in melanoma, the diameter goes more than 6 mm. E for evolving, right? Evolving. Okay, so this is ABCD rule, that doesn't matter. Now there is one thing, how to grade this melanoma. There is two grading system, that is Clark grading system and the Bruslow's depth, right? Bruslow's depth. So Clark and Bruslow has graded, help in grading this melanoma into different grades based on how deep they are coming. So if I take the dermis, if I am taking the epithelium here, okay, so if according to Clark, what it is, if this is epithelium, this is your connective tissue. So if the tumor is within the epithelium, it is called Clark grade 1, right? Clark grade 1, it is within the epithelium. Now if it is coming till here, it is penetrating to the dermis, it is coming till here, we call it Clark grade 2. So Clark grade 1 is within the epithelium. Clark grade 2 is what? It is penetrating the dermis. Penetrating the dermis. It just penetrated the dermis. Now Clark grade 3. grade 3 is, okay, that fills up this papillary dermis. It is coming here and filling up the papillary dermis. What is this papillary dermis? Papillary dermis is the area where you see the recurrences. So the tumor will come, and it got erased. Okay, so this is Clark grade 2, and Clark grade 3 is, it is filling up the papillary dermis. Okay, Clark grade 3, it fills the papillary dermis. Okay, means where there is return that area is called a papillary dermis. Now if it is coming till here where you have the connective tissue fibers, it is called a Clark grade 4. Clark grade 4 is the tumor is coming till the reticular dermis, and if it reach more deeper till the fat regions, it is called Clark's grade 5. Okay, so this is about Clark grading. This is very easy. Breslow's depth also, it is based on this depth. It is measuring in mm. Okay, the only difference is they are measuring in mm. Okay, now both these are for your skin. They can be only used in dermis, in the skin. This is not for oral mucosas. Okay, so what is there for oral mucosal melanomas? For oral mucosal melanomas, we have a grading system called a Westop. Okay, Westop grading system. Okay, just remember Westop grading system is used for oral mucosal melanomas. Your Clark and your Breslow, etc., are used only for your skin where there is dermis. And there was one question in the one of the NEET examination regarding the staging. Okay, staging. So this is the staging based on the mm, how deep the mm is coming. So there was a question in I think 2 years before in NEET or last year INICT. Okay, there was a question that a melanoma of 2 mm in depth comes in which stage? Okay, you can see that till 2 mm it is T2, right? A melanoma of 2 mm in depth is what stage? Okay, so you can see this 1 mm, if it is 1 mm or less than, then it is what T1, in 1 to 2 is T2, 2 to 4 is T3, and more than 4 mm, 4 mm, not centimeters, mm, okay, is your T4. That is, we are seeing the thickness. Okay, the thickness or the depth we are saying. Okay, so this is our your melanoma. I hope it is clear. See you in the next video with a new topic.